Welcome back to our channel Pharmalix. Today we are continuing with our GPAT Rapid Revision series. I am Sudhanshu and I welcome you all in our GPAT Rapid Revision series part 2. The subject would be pharmacology and the chapter is anti-hypertensive drugs. This is one of the most important chapter of pharmacology in which every year in GPAT and NIPER at least 1 to 2 questions are asked. We are going to discuss 25 questions covering all the aspects of anti-hypertensive drugs. But before that, those who are visiting the channel for the very first time, do not forget to subscribe the channel so that all the updates related to GPAT, NIPER and Pharma vacancy should reach you at the very right time. So without further ado, let's get right into it. So the first question is, which of the following anti-hypertensive drugs is a calcium channel blocker? So here what you can see, which of them are calcium channel blockers. So for the calcium channel blockers, we already have a trick. We will discuss after doing this question. So is it lisinopril? No sir. Is it amlodipine? Yes sir. Is it metoprolol? No sir. Is it hydrochlorothiazide? No sir. So what did we do here? We used the elimination method. So here you see on the last of the drug. So here it is pril. So any drug ending with pril or ril, it is basically ACE inhibitors. These are the ACE inhibitors. And here we have LOL. So for LOL, we know LOLs are the beta blockers. And then we have hydrochlorothiazide. So any drug ending with thiazides, these are basically thiazides and a type of diuretics. Okay. And here amlodipine. Amlodipine is the correct answer. So that is how we reached out to amlodipine. But we could have solved this question through our trick also. So for the calcium channel blockers, always remember we can write Viro ka dil aam nahi. So this is a Hindi trick. So Viro means verapamil. Viro means verapamil. Dil means diltiazem. Diltiazem. And then am means amlodipine. Amlodipine. And then we have amlodipine is a calcium channel blocker that works by relaxing the blood vessels, reducing the peripheral resistance and lowering the blood pressure. So this is how amlodipine works. And lisinopril is an ACE inhibitor, metoprolol is a beta blocker, and hydrochlorothiazide is a thiazide diuretic. So this is how you have to learn, and this is a simple question from the classification which I always emphasize to learn. Okay, let's move to our next question. A patient with hypertension. A patient with hypertension and asthma should avoid which of the class of anti-hypertensive drugs? So see, there are few drugs which should be avoided if a person is having hypertension as well as asthma. So which are the drugs which should be avoided? So is it going to be ACE inhibitors? No sir. Is it going to be beta blockers? Maybe. Is it going to be calcium channel blocker? No sir. Is it going to be thiazide diuretic? No sir. So these are basically classes of drugs. So why beta blocker is the correct answer? We reached to the conclusion beta blockers, but why? See, beta blockers. So in first we have to see where our beta receptors are present. So see, it is a very simple trick. So how to learn where beta receptors are present? So if you want to find out beta blockers, so see, beta blockers are basically 3 types, but we will here discuss only 2 types. Beta 1, beta 2. So beta 1 is present in heart. Since we have only one heart, so beta 1 is present in the heart. And we have 2 lungs, so beta 2 is present into the lungs. So beta blockers like metoprolol can cause bronchoconstriction, which can exacerbate asthma. So non-selective beta blockers, see, there are selective beta blockers. Here we can write beta blockers, and there are selective, that which work on very specific beta blockers, and then there are non-selective. Okay, so for selective beta blockers, it will specifically work on beta 1 or maybe beta 2. But for non-selective, these can work on beta 1, beta 2 and even beta 3 also. So these are non-selective beta blockers, and these kind of beta blockers work on all kind of beta blockers, and thus they even stimulate the heart as well as the lungs. So working on the blood pressure, they can also exacerbate asthmatic symptoms. Okay, so that is why drugs like metoprolol are not given in the case of hypertension as well as asthma together. So the third question is, which of the hypertensive drug is contraindicated in pregnancy due to risk of fetal renal damage? So this question could also be asked, drugs which are not used in pregnancy during hypertension. So is it losartan? Is it amlodipine? Is it atenolol? Or is it furosemide? So here once we have diuretic, another we have a calcium channel blocker, a CCB, and then we have a losartan, that is ARB, that is angiotensin receptor blocker, and then we have a beta blocker. So what do you think? Pause this video. What do you think would be the correct answer? The drugs which are contraindicated during the pregnancy and due to risk of fetal renal damage. So the correct answer is going to be losartan. This is angiotensin receptor blocker. And why we are going to discuss this. So losartan is an angiotensin 2 receptor blocker which is contraindicated in pregnancy because it can cause fetal renal damage. So this is one of the very important point for the ARBs, okay, and especially for the losartan point of view, because it can cause renal damage, also oligohydramnios, and even fetal death. ACE inhibitors are also contraindicated for the same reason. So for the trick wise, if you have any drug which is ending with either pril, that is our ACE inhibitors, or sartan, that is our ARBs, so if you see these kind of drugs, so these kind of drugs will be contraindicated in hypertension during pregnancy. So very quickly, let's also see in which conditions, in which other condition basically angiotensin 2 receptor blockers are contraindicated. So we call them ARBs. So ARBs are contraindicated. First point in low blood pressure. Second, in other fatigue, headache or dizziness. Third, in swelling. Fourth, in allergic reaction. And fifth, whenever there is elevated potassium level in the body, they should be avoided. And sixth, which we have discussed, teratogenic or teratogenicity. So ARBs cause teratogenicity, that's something which is causing malformation of embryo. And then seventh is acute kidney injury. In acute kidney injury cases also, ARBs should be avoided. And then last is our nasal congestions. For nasal congestions, ARBs are not prescribed. So let's go to our next question, which is very interesting. A patient with hypertension. Again, a patient is presented with situation of elevated blood pressure and having gout situation. Should avoid which of the following antihypertensive drugs? Is it lisinopril, which is our ACE inhibitors? Is it hydrochlorothiazide, which is a diuretic, or we could say medium ceiling diuretic, that is our thiazide diuretics. Very nice. And then we have amlodipine, which is our CCBs, calcium channel blockers, and lastly we have our beta blockers. So which of the following should be avoided? So see, for the gout situation, there should be a drug which should elevate the uric acid level in the blood. We should elevate the uric acid level. For which of these drugs do you think uric acid will be elevated by the drugs? Is it going to be ACE inhibitors? No, sir. Is it going to be hydrochlorothiazide? Yes, sir. It is a thiazide diuretic, and thiazide diuretic increase the uric acid. And then amlodipine, no. Metoprolol, no. So correct answer is hydrochlorothiazide. And here we have the explanation that hydrochlorothiazide can increase the serum uric acid level, potentially exacerbating gout. Patient with gout should avoid the thiazide diuretic unless absolutely necessary. Okay. With this, let's go to our next question. And this question says, which of the antihypertensive drug is most likely to cause a persistent dry cough as a side effect? So this is a drug which causes dry cough. So is it going to be losartan? No, sir. But losartans are avoided in nasal congestion. For lisinopril, which is our ACE inhibitor. So ACE inhibitors prevent the breakdown of bradykinin. And bradykinin is a naturally occurring substance that causes blood vessels to widen. That means it causes vasodilation. But at the same time, it reduces the mucus. Formation and thus causes dry cough. So with these two functions, for once it is helpful, for the other one it is not so helpful. So lisinopril is going to be our correct answer. This is how you can see lisinopril is an ACE inhibitor known to cause persistent dry cough up to 20% of the patient due to accumulation of bradykinin. ARBs like losartan do not have this side effect, since ARBs show this kind of side effect, but especially losartan. With losartan, we do not face these kind of side effects. ACE inhibitor side effects. So for ACE inhibitors, so you can learn by this factor called captopril. So captopril. C for cough or persistent dry cough. A for angioedema. P for potassium elevation, that is hyperkalemia. So for ARBs, potassium elevation, it was contraindicated, but in here it is causing the potassium elevation as a side effect. Then here taste changes, metallic taste, orthostatic hypotension, or it is also known as postural hypotension. And then we have pregnancy issue, that is teratogenic, renal impairment, increased creatinine level, and leukopenia and neutropenia, rare side effects. Okay, so this is the trick through which you can learn the side effects of ACE inhibitors. Which of the following is a first line antihypertensive drug for most of the patient? So here it is asking the first line antihypertensive drugs. So is it going to be spironolactone? No. Is it going to be hydrochlorothiazide? Yes, because through diuretics are the first line of treatment. And is it going to be clonidine? No. Is it minoxidil? Minoxidil? Of course not, because minoxidil are now being used to increase the hair growth. Okay, so the correct answer is hydrochlorothiazide. And let's see how do we reach to this answer. Hydrochlorothiazide is thiazide diuretic and is considered as a first line antihypertensive drug for most patients due to efficacy and safety and the cost effectiveness. So these are the classification which I'm always emphasizing, that one must learn the classification for antihypertensive drug. There are maximum chances that you can solve your question if you have only learned the classification of the antihypertensive drugs. Let's go to our next question. A patient with hypertension and diabetic mellitus would benefit most from which of the class of antihypertensive drugs? So is it going to be beta blocker? No, sir. Is it going to be calcium channel blockers? No, sir. Is it going to be ACE inhibitors? Maybe. Or is it going to be thiazide diuretic? No, sir. So ACE inhibitors would be the correct answer. And let's see how did we reach to that conclusion, that ACE inhibitor like lisinopril are preferred in the patient with diabetes because they provide renal protection. Okay, so due to the factor of renal protection, these are being used, and these reduce the risk of diabetic nephropathy. Hypertensive drug can cause hyperkalemia as a side effect. So see, hyperkalemia means elevated level of potassium, and we have already discussed it, though we are going to do it again. So here, is it going to be hydrochlorothiazide? Maybe. It's a diuretic. It's a thiazide diuretics, and thiazides are potassium wasters. Always remember, thiazides are potassium wasters. So they are not going to elevate the potassium level, but they are going to decrease the potassium level. So is it going to be furosemide? No. They also, in a way, they also reduce the potassium level. So furosemide is also not going to be the answer. Is it going to be spironolactone? So potassium is a pairing diuretics. So spironolactone also known as potassium is pairing diuretics. So this could be our answer. Amlodipine is also called CCB, or these are the calcium channel blockers. So the amlodipine is also not the answer. So the correct answer is spironolactone. Spironolactone is, most number of cases, most number of pharmacist exam, most number of GPAT exams, and in the most number of times it has been asked in the NIPER exam. So learn about its classification, learn about its side effects, learn about its mechanism of action. So these are the three questions which could be asked from the spironolactone. So spironolactone are the potassium sparing diuretics, which we already said. So it causes hyperkalemia, especially in patients with renal impairment. Okay. So these are the side effect of the diuretics which you can learn from this table. Okay. So a patient with hypertension and heart failure would benefit the most from which of the following class of anti-hypertensive drugs? So here the patient is having elevated blood pressure plus heart failure situation. So which of the drug should be given? Is it going to be beta blocker? Maybe. Is it going to be calcium channels blockers? Maybe. Is it going to be thiazide diuretics? No, sir, because in heart failure, thiazide or any diuretic are not prescribed. Is it going to be a ACE inhibitors? So ACE inhibitors? Maybe. So the correct answer here would be ACE inhibitors. And why, sir? So why ACE inhibitors? Because ACE inhibitors reduces the preload and afterload of the heart. So thus it reduces the cardiac output. So cardiac output is reduced, and thus the hypertensive situation is also reduced. So this is why ACE inhibitors are beneficial in heart failure and thus used in heart failure along with the hypertension. So basically these are the drugs. These are the basically mechanism of action, how it works. So you can either take it from here, or we have the separate video for our hypertensive drugs, which you can refer to understand it more. Next question is, which antihypertensive drugs is most likely to cause peripheral edema as a side effect? So which antihypertensive drug is going to cause the peripheral edema? Do you know? If you know, pause the video, tick the correct answer and see if you are heading in the right direction. So is it going to be lisinopril? No sir. Is it going to be amlodipine? Yes sir. Calcium channel blockers causes peripheral edema. And then is it going to be metoprolol beta blockers? No. Is it going to be hydrochlorothiazide? No sir. So amlodipine is the correct answer. Let's see how. So amlodipine, a calcium channel blocker, is known to cause peripheral edema due to its vasodilatory effect, particularly in the lower extremities. For the lower extremities, we means these are the upper bodies and then we have the lower bodies where we have our legs. So in the lower extremities, it causes a little swelling, and this is due to the peripheral edema side effect of amlodipine. Okay, so side effects of calcium channel blockers is slower the heart rate, that is bradycardia, hypotension and headache, reflex tachycardia, and edema and dizziness. So peripheral edema is one of the major side effect of calcium channel blocker, that is amlodipine. And then we have which antihypertensive drug is contraindicated in patients with bilateral renal artery stenosis. So if somebody have gone through bilateral renal artery stenosis, which of the antihypertensive drug should be avoided? Is it going to be losartan, amlodipine, metoprolol, and hydrochlorothiazide? So see, I have taken these for example because these are from the separate classes of drug, and this is how we memorize that which class of drug has which kind of side effect and what class of drug are contraindicated in different situations. So if you have the answer, take it in your mind and see if you are heading in the correct direction. So the correct answer here is going to be losartan, that is our ARBs, angiotensin receptor blocker. So since we have already discussed it previously, we are not going to repeat it. So ARBs like losartan and ACE inhibitors also contraindicated in the bilateral renal artery stenosis. Which of the following is centrally acting antihypertensive drug? So this is one of the most important question, because there are very few drugs which are centrally acting antihypertensive drugs. So is it losartan? No sir. Or amlodipine are centrally acting? No. Or metoprolol are centrally acting? No. So clonidine is the only drug which are centrally acting in the drug, especially in our alpha 2 receptor. They are working on the alpha 2 receptors, and that's clonidine. Clonidine is centrally acting alpha 2 agonist. So these are alpha 2 agonist. It reduces the symptom outflow of central nervous system, leading to decreased blood pressure. So these are the classification again, and here you can see central sympatholytics, clonidine and methyl dopa. So very often methyl dopa is also asked. So people have to comment which name is given to methyl dopa and what kind of the hint is it is something related to the neurotransmitter. So we have reached to our last question of this video. Which antihypertensive drugs works by blocking the binding of angiotensin 2 to its receptor, leading to vasodilation and reduced aldosterone secretion? So see, this is mechanism of action based question, and I believe if you know the mechanism or classification of antihypertensive drugs, it is going to be one of the most easiest question. So here we can see angiotensin 2 receptor, that means ARBs, and ARBs means losartan, and this is the correct answer. Let's not waste your time. So losartan are the correct answer. Why? You can refer it from here. So with this, we have reached to the end of our video. Before we conclude, I would like to request all to subscribe and like the video so that we also get encouraged and you also get the right direction to your preparation. Also, we bring all kind of news and update regarding pharmacist exam, pharmacist preparation, GPAT and NIPER preparation, GPAT, NIPER admissions, as well as other colleges including Punjab universities, DPSR, and all the GPAT and NIPER related colleges. So thank you so much for joining. Stay tuned to Pharmalix. Keep learning and keep growing.